Hello, this is the training video for the mid-turbinate swab or rtPCR. When your patient checks in, they'll be checking in with the on-site lead or production assistant. As they're checking in, that is where we instruct them on-site to use hand sanitizer. Okay? So the on-site lead will hand them a specimen tube and a swab. Okay? The on-site team will already place the label onto the tube. So once the patient sits at your station, one, they'll have their mask on and encourage them to keep their mask on, okay? There's hand sanitizer in their station. Instruct them to use hand sanitizer again. Make sure it's nice and dry because we can't let the wet hand sanitizer touch the tube because the label is now on here. If they get hand sanitizer on here, it's going to smear. So please make sure their hand sanitizer is dry before they touch this tube, okay? So as I mentioned, the on-site team will put the label on here. Your job is to make sure that they verify their first and last name is spelled correctly and that their date of birth is written below. And right where you see that little dash, hashtag, or pound sign, whatever you want to call it, that is where you will instruct them to write down your station ID number, okay? So once you do that, have them take out the cap, place the cap right side up so it doesn't get contaminated, and then instruct them to place the specimen tube in the tube holder right in front of them, or you can say the plastic thing with holes. And that's just because there's a solution in here, we can't let it spill or topple over. Okay, so at this point, this is where you instruct them to pull their mask down so just that their nose is exposed. Some of their test sites are in an enclosed area, and the last thing you want is for them to sneeze and just spread droplets everywhere. It takes a while for that to dissipate. So have them keep their mask on. It's fairly easy. And just for training purposes, I'm just going to put this off to the side, but you get the idea that they have to keep their mask on, okay? So now have them reach for the swab. Doesn't matter which brand you use, each swab will always say peel here on one side. So have them peel at that side just about an inch or two so they can reach in and grab the swab. Okay. I know you've seen, and you may see a couple of different swabs. So this particular swab has a demarcation, an indentation right here. We've used other swabs where there's a red mark. Know that it's pretty much the same location, each swab we use. So I like to use this as my marker. When you're doing the mid-turbinate swab, you only need to have the patient insert about 1.5 inches to 2 inches into their nose. So I like to tell them, use this as your marker and go about 2 inches above that line, so about right here. If someone says, well, I don't know what 1 inch is, that's fine. Pay close attention to the swab, see where it's thick and starts to get medium thickness and then skinny thickness. Have them take their thumb and pointer finger and pinch right where the skinny and the medium thickness meets, about like right there. So you have about like a little over 2 inches right there. Okay, once you've confirmed the placement of their fingers is correct, have them move to the side, tilt their head back, keep their mouth open, and always make sure that it's this arm that's away from the camera, because if they do it this way, it'll block your view and you won't be able to direct them correctly, okay? So have them tilt their head back, keep their mouth open, instruct them to insert towards the center of their nose, and then angle towards your ear or towards the back of your throat. Once their fingers are touching their face, that's how you know they are at the correct location, okay? Their fingers need to touch their face, so about 1.5 inches to 2 inches. We're at the mid-turbinate location of the nostril. So once they're here, instruct them to roll the swab for 15 seconds, okay? So they need to do a roll. We've had some people do this only to have this break off and then this gets stuck inside, and that's not good. So please instruct them to roll. If you see them start to do a really lazy, not a really good swirl or roll, stop counting and tell them you'll continue or resume counting once you see them do this rolling. Because it's in this roll where we're able to get a lot of the RNA sample, okay? So 15 seconds, count out loud for them. have them remove, slide into the other nostril for slide into the other nostril and angle towards the ear, towards the back of the throat. Again, it's just 1.5 to 2 inches. Make sure the fingers are touching the face and instruct them to roll. So it's not too bad. Okay, so 15 seconds, remove, have them insert into the specimen container, have them bend right where that indentation is. It'll snap in half. Place the cap on. Once it's nice and tight, have them baton twirl 10 times. Once they've baton twirled, instruct them to head towards the exit where they will scan and submit their sample. Thank you.